Now it's an esteemed pleasure to welcome Dr. Peter. Dr. Peter is a very busy clinician, as I understand, very busy cardiologist, and he's an academic cardiologist. And I remember Dr. Peter when he was here, he also won, I think, the best paper award in the Clinical Indian College of Cardiology. The competition. Abstract competition. So let's hear Dr. Peter on management of hypertension in Black population.
Thank you, Prof, my mentor, my teacher. Thank you very much, sir. Sir, we should congratulate you, sir, for organizing a very wonderful conference. And also thank you, sir, for the mentorship. I really appreciate that, sir. Well, I'll be presenting this evening, on the management of hypertension in Black populations. Hypertension, I'm using your ESC definition of hypertension, 2018 definition of hypertension. Office blood pressure of up to 140/90, or ambulatory blood pressure of up to 130/80, or home blood pressure monitoring of up to 135/85.
Hello.
Hello.
Yes. How are
Hello.
you?
Yeah, Dr. Peter, we can hear you and see you. You continue.
Hypertension affects 1 billion people worldwide in 2014. That comprises 22% of the world population at that time. Africa have the highest prevalence of hypertension, even at that time. The Black population generally have the highest number of hypertension worldwide. Both Africans and the African Americans, as you can see in this. However, in my country, about 1/3 of our patients with hypertension are not even aware they are hypertensive. And this is the world prevalence of hypertension. From this map, you can see that the red marks, whereas with both the males and females, are in sub-Saharan Africa. Most of them are in Africa, and particularly in sub-Saharan Africa, have the highest prevalence of hypertension. And that constitutes the majority of the Black population worldwide. And permit me to say that my country have one of every 6 Black men is a Nigerian. So when we talk about management of hypertension in Black population, we are talking about management of hypertension in Nigerian population indirectly. This is also a UK study that shows that Afro-Caribbeans have the highest prevalence of hypertension in UK population. So hypertension is a Black man's problem. Affect Black man more than all, and the hypertension have been found to be the highest cause of mortality, far above obesity, alcohol, cigarette smoking, and all other risk factors. Hypertension found to be higher than all other risk factors. In my country, a study was done by OGI in Abuja. It found that about 75% of hypertension present for the first time with complications. Now, what are the peculiarities of hypertensive patient in Nigeria, in Black generally? One, Black population have higher prevalence of hypertension. We have earlier onset of hypertension. Also, our patients have the higher prevalence of non-dippers, and non-dippers have been found to have higher complications. Hypertension in our population has also been found to be associated with higher non-medical beliefs on our populations, and that affects our adherence greatly. Now, we have salt-sensitive patients that are low-renal hypertensive. Now, the Black population generally have higher reactivity to a number of physical and mental stressors, e.g. like video game challenge. In fact, study was done among children playing video games. Their blood pressure was taken before, pre and post, and during the video game challenge. And it was found that the African children have higher blood pressure rise during the blood pressure rise during the video game challenge when compared to their white counterparts. Black population also have higher risks of, according to Mayo Clinic report, blood pressure is more difficult to control in Black population than the other races. Now, how do we treat hypertensive patients? First of all, we evaluate the patients. And evaluating patient, the history should be taken. And in taking history of a patient with hypertension, we have to look for history of duration of hypertension and also assess also ask for history of other cardiovascular risk factors and complications of hypertension. A patient that presents hypertension provides opportunity for further evaluation of that patient. Now, because hypertension is a disease that has multifactorials, so treatment also involves multidisciplinary approach. Patients have to be counseled, dietary approach, like dietary approach to hypertension. Then Nigerian guideline too have a guideline for treatment of hypertension that involves low salt diet, avoiding processed foods, and then more intake of boiled or grilled foods instead of fried foods. Also, other non-medical, other lifestyle measures in measuring hypertension in blacks that we employ in our country is using the WHO exercise regime, aerobic exercise of at least 150 meters in a week. Now, because the prevalence of hypertension, because the mechanism of hypertension is multi-dimensional, there are no single drug mechanisms can treat hypertension in most of our populations. Oh my God. In most of our populations. So therefore, most of our patients will benefit from combination therapy because they usually present with higher blood pressures than required. Now, this is just a guideline. This is not a statement from the guideline of from Nigerian guideline in managing hypertension. This guideline shows it stated that diuretic and calcium blocker are the most effective for black population everywhere in the world. And this is mainly because black population are have low renin hypertension, and therefore they benefit more from it. Beta blockers, RAS blockers, and alpha blockers are less effective and so not advisable as monotherapy for hypertension in blacks. The South African guideline also support this by saying that in a black hypertensive patient, ACE inhibitors and ARB are not effective. However, if combined with a diuretic or a calcium channel blocker, they are as effective as the non-black population. Now, this is just a summary of different guidelines. All of them supported the use of calcium channel blocker or a diuretic or combined as a first-line therapy for black population, especially those that are not diabetic and those that do not have renal diseases. So, in conclusion, hypertension in black population is a multidisciplinary approach. It's not a doctor take all. We involve the nurses, sometimes the clinical psychologists, the dietitians, and other health workers in managing hypertension. And in managing hypertension, it's important for us to know that it's a teamwork and we should manage the patient holistically and not the number of the blood pressure. Thank you very much, sir. Thank you.
Thank you, Dr. Peter. That was very good and very well presented and very well studied. And as usual, I told you, you are an academician. You have the knack of
Thank you very much, Professor.
reading and understanding the journals well and the studies well and doing good research.